My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that reduction in sleep apnea with weight loss medications, the role of GLP-1 agonists obstructive sleep apnea, OSA, is a prevalent and often serious condition characterized by repeated episodes of partial or complete obstruction of the upper airway during sleep. This obstruction leads to breathing pauses, reduced oxygen levels, and fragmented sleep. OSA is strongly associated with obesity, with increased body weight contributing to the narrowing of the airway and the development of the condition. Weight loss is one of the most effective ways to manage OSA, as it reduces the fat deposits around the upper airway, decreases the overall load on the respiratory system, and improves the mechanical properties of the respiratory muscles. This is where GLP-1, glucagon-like peptide-1 agonists, a class of medications primarily used for weight loss and the management of type 2 diabetes, come into play. Understanding GLP-1 agonists. GLP-1 is a hormone that plays a crucial role in glucose metabolism and appetite regulation. It is released in response to food intake and stimulates insulin secretion, inhibits glucagon release, and slows gastric emptying. These actions collectively help regulate blood sugar levels and promote a feeling of satiety, leading to reduced food intake. GLP-1 are medications that mimic the action of the natural GLP-1 hormone. They are designed to enhance these effects, particularly in people with type 2 diabetes and those struggling with obesity. By increasing the duration and intensity of GLP-1's effects, these medications help individuals lose weight by reducing appetite, leading to lower calorie intake, and promoting a sense of fullness. This is how weight loss via GLP-1 agonists reduces sleep apnea severity. The reduction in sleep apnea severity with weight loss, particularly through the use of GLP-1 agonists, can be explained through several physiological mechanisms. Reduction in fat deposits around the upper airway. Obesity leads to the accumulation of fat around the neck and throat, which can narrow the airway and increase the likelihood of obstruction during sleep. As GLP-1 agonists help individuals lose weight, the fat deposits around the upper airway are reduced. This reduction in fat decreases the external pressure on the airway, making it less prone to collapse during sleep, thereby reducing the frequency and severity of apnea events. Decreased inflammation and improved muscle tone. Obesity is associated with chronic low-grade inflammation, which can affect the tissues and muscles surrounding the airway. Weight loss achieved through GLP-1 agonists has been shown to reduce systemic inflammation, which can help improve the tone and function of the upper airway muscles. Improved muscle tone helps to keep the airway open during sleep, reducing the occurrence of apneas. Lowered respiratory load. Excess weight, particularly in the abdominal region, increases the load on the respiratory system, making it harder for the diaphragm and other respiratory muscles to function effectively. This increased load can contribute to the development and worsening of sleep apnea. Weight loss reduces the burden on the respiratory system, improving overall respiratory function and decreasing the likelihood of airway obstruction during sleep. Improved metabolic function. Obesity is often accompanied by insulin resistance and other metabolic disturbances that can exacerbate the risk of sleep apnea. GLP-1 agonists improve insulin sensitivity and glucose metabolism, which can have a positive effect on overall health and, indirectly, on sleep apnea. Improved metabolic function can lead to better regulation of body weight, further supporting the reduction of sleep apnea severity. Reduction in comorbid conditions. Obesity is associated with several comorbid conditions, such as hypertension, type 2 diabetes, and cardiovascular disease, which can exacerbate sleep apnea. By helping individuals lose weight, GLP-1 agonists can also help manage these comorbidities, which may contribute to an overall reduction in sleep apnea severity. Clinical evidence supporting the use of GLP-1 agonists for sleep apnea reduction. Several clinical studies have demonstrated the effectiveness of GLP-1 agonists in reducing weight and, consequently, improving the severity of sleep apnea. Research has shown that individuals who achieve significant weight loss through the use of GLP-1 agonists experience a reduction in the apnea-hypopnea index, AHI, a measure of the severity of sleep apnea. This reduction in AHI is often accompanied by improvements in other markers of sleep quality, such as oxygen saturation levels and the overall duration of apnea events. Brought to you by weightrx.org and fenterminuteclinic.com.